And to kind of maybe demystify some of the information that comes out there. Like one bad, terrible outcome can make media all around the world. And, the percentage of that can be incredibly small, like something like, permanent nerve damage.
Yeah. So it's fabulously rare. I guess as far as permanent nerve damage goes, to put it into a context, there is a chance with an epidural in particular, also with a spinal, but less so. But your chance is something akin to your chance of dying in a car crash in Adelaide every year, right? So amazingly low. If you get in your car, drive around, you're not petrified about that outcome.
Today it's going to happen.
Your anaesthetic, your spinal or your epidural is essentially safer than that from a permanent nerve damage point of view.
Yes.
So we're talking 1 in 50,000 to maybe 1 in 100,000, something like that. So amazingly rare, but it does happen.
Yes, and that's a part of that information sharing, and so that they understand. A lot of medicine especially is just treating one bit and then going away. And at least this one you can see it from the start to the end.
That's right, do one job, do nothing else until that's finished, do it properly, move on to the next job. It works for me.
Yes.
So 1 in 200 ladies will get a bad headache like a migraine afterwards, after an epidural. And sometimes that'll need to be fixed with another epidural in a couple of days. Blood patch, that's about 1 in 200. That's really irritation for those 1 in 200 because it'll lay you flat for 2 days to a week in bed. But once again, 199 out of 200 won't get that.
Yes. And if you think about that in a normal size maternity unit, that's, 1 a month. Yeah. If that.
Yeah. 1 in 1,000 ladies will have a temporary irritation of a nerve in their back.
Okay. Like a backache?
No, causing some maybe numbness or weakness in the legs, for example, or a tiny little patch in the legs perhaps.
Oh, there's some people that go, this bit's numb.
Yes, that's right. Okay. So 1 in 1,000 will have that gets better, but takes days or weeks to get better. Okay, so it's 1 in 1,000. But as I said before, as far as significant nerve damage goes, not going numbness or weakness.
No.
Fabulously rare, but not impossible.
And it's not like, the risk of having a car accident once a year in Adelaide doesn't stop you driving around.
Absolutely not, no.
So you have to kind of really put that in perspective as well. And reactions to epidurals and spinals, is there very many?
Well, with regards to epidurals, most work really well. As far as reactions go, both an epidural and a spinal will cause your blood pressure to go down to a certain extent. So we'll measure your blood pressure often after they both go in. And if you don't feel fabulous, just yell out. It's usually quicker for you to tell your anaesthetist or midwife, I'm feeling a little bit lightheaded.
Yes.
Than it is for a blood pressure cuff to think about it and tell us the same thing.
Yeah.
And that's easily fixed. You've always got a drip in a vein, some fluids or some medicine going and you'll feel better straight away. So that's common, it's temporary, that's not the end of the world.
And we've kind of already had a bit of a chat about the postnatal medications and the fact that you might start off stronger and then certainly when you go home you get some education and some awareness about how to wean down on those things. But it's not like maybe when a doctor prescribes you a course of antibiotics and you think, I better take them all. Certainly postnatal medications, anti-inflammatories have certainly got side effects. Paracetamol's fairly safe, but your stronger painkillers, if you don't need them, you don't keep taking them because they got prescribed to you. Yeah. You just wean them down.
You take them when you need them, and if you don't need them, don't take them. That's quite right, because they do have their side effects. You've got no real chance of getting hooked on them if you're using them as suggested and stop using them when you don't need them. They'll disappear from your system pretty quickly.
Yes. And if you feel uncomfortable having some of those more, kind of narcotic-based medications at home, and you've kind of still got some left, you can always take them back to your local pharmacy and they'll dispose of them safely. Certainly the strong painkillers we don't encourage you just to put in the bin because you don't want someone to come across them. So, safe disposal of your medications.
Yeah, you don't want to leave things like that laying around in a cupboard for a kid to find.
No.
So once you're finished with them, take them back to your pharmacist to get disposed of properly.
And they'll do it properly. Or even think, I remember those drugs I had when I had a baby 4 years later. I've got a sore neck, I might take some Endone. Probably good to go back to the doctor and get that checked up, and don't share as well.
Yeah, that's right.
I do find that there's a bit of a climate of medication sharing amongst some friends that is quite worrisome actually, because what did I have the other day? Someone said, I was feeling a bit anxious, so my friend gave me her antidepressants, and I'm like, oh my god, don't do that.
It's not safe, it's not sensible, and it's probably not legal either, so just don't do it.
Yeah.
just
Maybe
don't
just
do
go
it.
to the
See your
doctor.
GP.
Yeah, absolutely, and get that advice just for you, especially with the pain relief medication postnatally.